I have an aunt who is, I consider undiagnosed right now. And in the Black community, it's pretty much stigmatized to kind of admit when we have Alzheimer's or any of the dementia.
It's a tough reality for many families.
Her not wanting to come to church as often anymore. Her not wanting to be around family as often anymore and being there, lingering.
And some never come to grips with the situation.
Her kids are still in that space of denial. They don't want to admit that.
Alzheimer's, a disease of the brain, it robs memories, steals personalities, and for many families and caregivers, it wipes out their savings.
It is a very, very costly disease.
The Alzheimer's Association estimates the average out-of-pocket cost for health care for someone with dementia not covered by Medicare, Medicaid, or private insurance can exceed $10,000 a year. In Louisiana last year, there were 200,000 family caregivers, totaling almost $5 billion for 2023 in out-of-pocket expenses just in our state alone.
That's counting those people that we can count. We don't know those who are undiagnosed or those who are may be diagnosed but refusing to go into treatment.
Delores Hurst is not just dealing with dementia in her own family. As the executive director of the Alzheimer's Association Louisiana chapter, she sees other families going through the same thing.
A wife reached out to me and she was like, I don't know what to do. He's sleeping at the business. I know I have to do something with the lawyers. I know I have to change the business in his name. My sons and my kids don't live in this state. They don't want to come down because they're like, I can't deal with Dad right now because I can't fight him. I don't want to fight him.
That's why it's important for families to plan, especially if a loved one is showing early signs of Alzheimer's.
100%. Get your business in order. Get your life insurance policies done. Get all of those things, estate planning, wills. Make sure that you have trusts in place.
Create a checklist and look into that loved one's health care coverage. Find out what's covered and what is not. Learn the difference between Medicare and Medicaid and what they will pay for, and look into long-term care insurance policies.
When it's transitional, when it's time, it's just an easy transition.
And be sure to let that loved one be a part of the decisions.
You want to keep the dignity of your loved one. You want to make sure that they still have decision-making power in their lives. Because guess what? They still want to be respected. They still want to be loved.
The Alzheimer's Association is always there to help any family every step of the way.
You are not alone. They can find all of our information on our chapter at alz.org/Louisiana.